My name is Dr. Scott Storm, and I'm a clinical psychologist here with the SJC School-Based Clinic, which is a consortium with Angelo State University and San Angelo Independent School District. I have been practicing psychology for the past, I'd say 15 years. My doctorate is a doctor of clinical psychology, and I also have a 2-year postdoctoral fellowship in child and adolescent neuropsychology, and currently reside here in San Angelo, Texas, with a family of 3, and 2 of my children attend San Angelo Independent School District. Yeah, the majority of children that we see here at the San Jacinto Clinic, I've been told, I'm still not saying it right, but you know, SJC Clinic is primarily the children do not, they're covered either by Medicaid or CHIPS, which is the state insurance for those that can't afford it, or if you're under the age of 18. But we also see a very large population that's considered to be indigent, meaning that they make a little bit too much money to be on Medicaid or CHIPS. CHIPS basically kicks in when you like a little too much more money than Medicaid, and then you have like a $5 copay with CHIPS. But we have a lot of families that the cutoff is, believe it or not, is extremely low. The amount of money what they consider to be over the limit. So we see a lot of families that are over that cutoff point, but they don't have the money to afford to pay for private insurance. So we pick up a huge amount of people based on a sliding scale fee, based on family income and number of people in the family. So we do see a lot of uninsured, or what I would refer to as underinsured people in the community. Culture plays a tremendous role in the services that we provide here at SJC. I have a secretary that I've been working with for a number of years who's bilingual, and the majority of the people we see are Hispanic. About 80%, I think, of what I see is a Hispanic population. So I get a lot of extended family members that come in with their children. So we try to staff as much as we can with bilingual personnel. We have cultural competency training that we either get on our own or it's incorporated through the university in terms of understanding the different ethnic groups and some of their backgrounds. Also, there's most of the training that I do in that area are more state requirements that are required by the state boards and things like that. But it's very important to realize that the Hispanic population is very different than the Caucasian population. I see, like I said, about 80% Hispanic and 20%, I would say, or 19% Caucasian, and probably less than 1% African American. So, primarily we're focused on getting cultural competency training in the Hispanic population.
I'm Dr. Jane Ryder. I'm a pediatrician, and I do the general pediatrics here. Well, the majority of the children have either Medicaid or CHIPS, although we serve a number of children with no health insurance and no resources. Sometimes they're in between insurance. Sometimes they just don't qualify for anything. Try to be very sensitive to the cultural differences and to tailor our care in such a way that the parents understand why we're doing it, and it fits in with their cultural practices and knowledge bases.